Greetings. This is Justin Allen, the Elite Nurse Practitioner. This is the Orthopedics for the Nurse Practitioner Course. This is the Elite Nurse Practitioner guide on how to evaluate and treat the most common orthopedic complaints seen in practice. No matter what specialty you are in, no matter what niche service you provide, you will see patients with orthopedic complaints. I mean, it could be anything from very minor complaints to very complex complaints, okay? I mean, even in my medical cannabis clinic, people complain of orthopedic stuff. My men's health clinic, I hear about it all the time. Neck pain, back pain, sciatica, wrist sprains, those sorts of things, okay? So I think it's a good idea to be a very well-rounded provider to know how to treat orthopedic complaints. And this course is designed to go over the foundational concepts of orthopedics and to go over the most commonly seen orthopedic complaints and illnesses that you will see in practice, okay? So this is a great little clinical course. We're going to have more of these clinical courses coming out in the future. The authors. I'm Justin Allen. I'm a family nurse practitioner. I'm owner-operator of the Elite Nurse Practitioner. I own 2 men's health practices, and I also own a medical cannabis clinic. I went from 0 to 70,000 a month in less than 3 years, okay? So I love operating businesses and little niche practices. We pretty much provide hormone replacement therapy, IV infusion, weight loss services predominantly, but we also do some other stuff. I mean, I do see people with orthopedic complaints. I mean, I do plantar fasciitis injections all the time. I'll do knee injections. I'll do shoulder injections, trigger point injections. So like I said, these things are good to know. It is good practice to understand the foundational concepts of orthopedics. And this is Evan Cataldo. He is an orthopedic nurse practitioner. He's been doing orthopedics for almost 6 years, okay? So he's going to be going over the clinical components of this course, all right? He's also an entrepreneur. He's co-founder of preceptoro.com, and the website is coming soon, so check that out a little later. All right, so what this course provides. So our aim is to provide nurse practitioners foundational knowledge in orthopedics so they can evaluate, treat, and refer the most common orthopedic complaints seen in practice. As the aim of this course is to teach you what you need to know about orthopedics so you can feel more comfortable seeing these patients and knowing what to do. In addition to that, you are going to earn some continuing education credits to stay up to date with your licensure and certifications, all right? Now, it doesn't matter if you operate a men's health practice, like I said before, an IV infusion clinic, primary care, hormone replacement therapy, whatever it is, all right? You are going to see these patients. You are. If you are not, I don't know what kind of practice you are in. People will always complain about musculoskeletal ailments, all right? It is a part of life. If you've never had any kind of musculoskeletal pain, hats off to you, because I sure as hell have. So what do? You refer them out to someone else, or do you evaluate and treat them in your office? Personally, that is up to you. But the more value you can deliver to your patients, the more successful you will be. Doesn't matter what kind of practice you operate. It doesn't matter. If you can treat patients for a variety of different illnesses, it will increase patient satisfaction and the convenience, and it will increase the value. I have a men's health patient. I see him every 6 months. He comes in for a plantar fasciitis injection. He could go to an orthopedic office, wait hours, booked out months and months, be charged an arm and a leg, all right? He comes in, it literally takes 5 minutes, and he is a patient for life. Not only is he getting his testosterone replacement therapy and whatnot, but he also gets those plantar fasciitis injections from me. So that's what I'm saying. The more you can offer, the more well-rounded of a provider you can be, the more value you will deliver to your patients. Now, this course will cover 50 plus of the most common orthopedic complaints seen in practice. We're going to cover everything from cervical lumbar radiculopathies, shoulder injuries, ACL tears, a variety of fractures, wrist sprains, and much, much more. All right. Now, course topics. So we're going to go over the foundations of orthopedics, what you need to know to understand about orthopedics, okay? When to splint, when to cast, all right? The difference between radiological studies, MRI versus X-ray versus CT. When do you order those? When do you refer? Can you treat it, or do you need to refer it out? Types of fractures, and how to consult or even refer appropriately to ortho. We're going to go over neck pain, neck injuries, back injuries, shoulder injuries, and complaints, elbow, wrist, hand, rib fractures, hip injuries, knee injuries, ankle injuries, foot injuries, basically everything from head to toe that you will see in practice, okay? After you take this course, you should have a solid understanding of foundational orthopedics, all right? You really should. I learned a lot going through this course with Evan. And I worked urgent care for almost 10 years, okay? I saw this stuff on a daily basis, and I still learned some stuff. So it's a great course. We're also going to cover some business considerations on how to integrate orthopedics into an insurance or cash accepting practice, okay? How to bill appropriately. So how to bill these visits if you're accepting insurance. how to charge cash rates for it if you decide to do that, how to negotiate cash pay rates with imaging centers. That's really important if you're operating a cash-based practice. My men's health patients, I can get them an MRI of their lumbar spine without contrast for $300, and that includes a radiology read. That is one heck of a deal. So it's a good thing to know how to do those things. We're also going to go over some supplies you might need to have for dealing with orthopedic issues, and we're going to go over some niche orthopedic ideas. All right. So what is orthopedic care? Orthopedics is a branch of medicine that is concerned with evaluating and treating conditions associated with the musculoskeletal system. Back pain, neck pain, various injuries, etc. For the nurse practitioner, evaluation surrounds diagnosing the problem effectively and treating the condition within their scope. You can do most of the stuff within your scope, all right? You can. So splitting, casting, sprains, fractures, okay? Conservative treatment options, pharmaceutical interventions, trigger point injections, joint injections, alternative treatment options, stem cells, PRP, peptides, those sorts of things. Monitoring the progression of the injury and condition, appropriately referring the patient to ortho for further treatment, including surgery, okay? That's really important. A lot of nurse practitioners have difficulty knowing when to refer and when they can treat. That is something that comes with practice, and we're going to go over a lot of that for you in this course, all right? Why provide orthopedic care in your practice? Like I said before, it increases patient satisfaction and the value you can deliver to your patients. Like I mentioned earlier, I evaluate and treat common orthopedic complaints at my men's health practice all the time. It saves my patients a lot of time and a lot of money, and they get a lot of value out of that. Plus, it keeps my skills up. And also, like I said, it increases patient satisfaction, and that patient becomes a patient for life, and that increases your patient volume and only makes you more successful. It can increase practice revenue. Why refer common conditions that are easily treatable under your scope? You can bill for ongoing visits and care. It blows my mind when nurse practitioners refer out wrist sprains and ankle sprains and just super basic stuff. Guys, you can treat that yourself and then earn the revenue for it for your practice, okay? Don't refer that stuff out. It's easy. It makes you a more well-rounded nurse practitioner, okay? Knowledge is power. The more you have, the more powerful of a provider you are going to be.